Hi, welcome to my channel. I'm Sungho. I'm a physical therapist from South Korea. Today, I want to talk about trauma physical pain. So, what is it? If you have a muscle problem, whenever you try to do some movement like this, you have the pain. But trauma physical pain is different. Some situation, you can do this movement without any pain. But if you get severe stress, your muscle get dysfunction, so you're gonna get the pain. Why it happen? It's not normal physical problem. It is your brain problem. So trauma physical pain have some traits. Number one, when you can do some of tests, you are totally normal because there is no problem. It's brain problem. Number two, so the regular exercise or therapist exercise doesn't impact. When some patient with this pain get therapist exercise, this exercise make him get more pain. Or this exercise become the trigger that cause the severe pain. Why? Because when the trauma comes to the brain, all over the area in the brain get activated. So how can handle this or how can fix this? Doing my technique, the piece of muscle contraction. Of course, I created this technique. I have spent my whole life to create this technique because I have trauma, chronic pain. To fix my problem, I need to make this technique. Honestly, my technique is not easy, so the normal people doesn't do this technique immediately. But if you are physical therapist or chiropractor, you can do it as soon as you learn how to do that. So there's some step. First step, find the problem muscle piece, not the muscle like trapezius or middle trapezius or rhomboid major, because if you have trauma physical pain and when the pain is going to get very severe, your whole muscle doesn't get strong contraction, piece of muscle very strong contraction. So we don't need to find the muscle, we need to find the piece of muscle. Second, the problem must piece, but before we get piece of muscle contraction, we need muscle contraction. Maybe 70% strong contraction. Step 3, finally you can get piece of muscle contraction. It is funny because you try to do contraction, the piece of muscle that get already contraction. So that is not normal idea. Why should we do this? Because if we do this, the very strong muscle cells, not just a very strong muscle cells going to the brain, but also your brain can feel 3D muscle image. So today's muscle is upper trapezius. First, find your piece of muscle. Second, get 70% muscle strength. So, and do the piece of muscle contraction. Be careful, not the muscle contraction, just piece of muscle contraction. Okay, my video is for specialists like physical therapist or chiropractor. If you can do a technique, you can do a lot of things. So I continue to talk about my technique. I hope it gives you a lot of help. Thank you for watching my video. Bye bye.